System.
Every October, the pink ribbon emerges to signify it's Breast Cancer Awareness Month. But behind all that pink are survivors and fighters.
Breast cancer is still the most common cancer in women worldwide. In this month's Eye on Health, I explain what the journey might look like for a patient at Beacon Health System, from diagnosis to the next steps.
A hard sentence to hear. You have breast cancer. Everything else?
Things like ductal carcinoma in situ, which are these early cells that don't actually have the ability to spread throughout the
fades into the background. Dr. Katherine Goze is a general surgeon. She's a part of Beacon Health System's multi-disciplinary cancer team.
The most important thing that I can tell a patient when they have breast cancer, when they come in to see me, is that they are not alone. That we are here with them to fight this disease with them.
She meets with patients after they've been diagnosed to explain the cancer stage and if it's spread. From there, she discusses treatment.
That is the question everybody comes in with. Oh my gosh, what's next? How terrible is this going to be for me, for my family? And really, it's a tailored conversation to the individual.
Goze says also on your team are breast surgeons, medical oncologists, radiation oncologists, and breast radiologists.
So by the time the patients are meeting the physicians, everyone has already had a chance to review all of their information and discuss it as a team.
Beacon says each patient is also assigned a dedicated oncology nurse navigator. That's where Kathy Hawley comes in.
And my first question to the patient is, how did the appointment go? Getting a gauge of what they understand from what the physician said, then me being able to fill in some of the holes for those patients.
As a nurse navigator, Hawley acts as a liaison between doctors and patients and is by their side at all stages of their diagnosis. She says you can expect an initial call from her post-surgery asking how you're doing and feeling, but her support doesn't end there. She continues to call or see patients throughout their cancer journey. Her support extends to patients' loved ones too.
I can't worry about her or the patient without worrying about you. She's going to rely on you for strength, for energy, for support.
Dr. Goze says she has hope in the fact that advances in cancer treatment are saving more lives than ever, but
Dr. Goze is emphasizing the importance of screening for early detection. It can catch the cancer even before you might know something's wrong. Women are recommended to start getting annual mammograms at 40 years old.
Sometimes sooner if we have strong risk factors, including strong family history, a history of radiation to the chest.
She adds medical treatment for breast cancer is still largely surgery, either a full mastectomy or partial, along with radiation. In that, Goze acknowledges what's left can affect self-image.
The presence of breasts is deeply rooted in the feeling and the identity of being feminine. And so reconstruction is a very important part of this journey and something that we are very cognizant of. In patients that require mastectomy.
And once the surgery ends, Goze says the rest of the treatments to prevent it from coming back begin.
The relief that I can see on a patient's face after I'm able to tell them that the cancer is out, that is the most rewarding part to me.
Goze says Beacon has a new partnership with local plastic surgeons to help coordinate, facilitate, and expedite the process of getting reconstruction surgery.